Okay. Do not worry, you will get a chance to read this book. It is just a glimpse of what I have been editing lately. I think there are some books needed in Nepalese dentistry because we follow some textbooks, we follow books from different countries, we follow a lot of online resources, we follow ready to gulp things. When we start thinking of ourselves as well, evaluating ourselves as well, evaluating as a whole individual ourselves, so we have to start thinking from different perspectives. A person becomes a dentist. He masters certain courses, he masters some working knowledge and starts a practice. When he starts a practice, he needs a patient. To get a patient, has to manage his or her clinic in the first place. After managing a clinic very perfectly, he has to market himself because the world is very competitive. Mr. A dentist, Mr. B dentist, Miss C dentist, Mrs. D dentists are queuing up here. There is one guy who can afford a dental treatment and there are 4 dentists here. This is practical thing which we are going through in our part of the world as well. Just for example, there is a businessman who can afford 5 implants. There are 10 implantologists standing here. So, how he comes to your practice, how he or she or that particular patient comes to your practice, your marketing strategy. 7 topic. Number 1, you master your practice, you master your knowledge, you clear your craft, you sharpen your skill. With the dental knowledge, you have to show that. You have to implement that. For that, you need a practice. So you design, you think of your practice. After the practice, you have to manage your practice. So management of a practice can be a third thing. After managing your practice, you need customers. So marketing is skill of yourself. So your marketing strategy you need. You need name. You need somebody calling you for this kind of social event, that kind of social event. Your community concerns, camps, dental health awarenesses, interviews in the television, interview in the FMV studios, a lot of things. After that, your boundary or your cubicle becomes bigger. You start coming out of your walls, coming out of your cubicles, coming out of your 4 walls, and then you start thinking, meeting a dentist from California, going to the conventions, conferences, giving a lecture, becoming a best dentist among 100 dentists, among the sea of dentists. So that is topic on learning, unlearning, and being global. With all this, still your hunger may not get shattered. You may not become satisfied, and you may need some extra dental activities. You become a kind of a leader. So these 7 things are confined within this small book, and you may get it very soon. I'm working hard in this lockdown. Lockdown is trying to be fruitful, but as all of you going through, there are certain hiatuses, there are certain pauses, there are certain halts because of uncertainties, because of lack of fuels, because of lack of a lot of connections, because of missing a crowd, a lot of coffee sub hoppings. Due to a lot of things are coming very slow, but I'm working. I think it works for you as well. So hope my book would be of help for you as well. Thank you and stay tuned. Stay safe, stay home.